behalf of the Massachusetts Association for Mental Health and our board chair, Ambassador Barry White, I'm pleased to join Mental Health America and its affiliates today in honoring our Massachusetts Governor, Charlie Baker, with MHA's B4Stage4 Governor's Leadership Award. Thank you to Paul Gianfrido, MHA CEO, and his talented team and board for recognizing the fine work of Governor Baker. In the 6 years since he was elected, Governor Baker has consistently prioritized his mental health as an essential component of health. This is most visible in budget proposals and policy changes that he has led or promoted, including support for parity legislation, regulatory direction to all payers to implement robust children's behavioral health and early intervention benefits, the anti-stigma campaign, More to the Story, no barriers access to telebehavioral health, which he first implemented in response to the pandemic and then made permanent. He's improved transparency for insurer-provider networks and increased affordable housing for individuals who receive public mental health services through a state rental subsidy program. His appointment of EOHHS Secretary Mary Lou Sutters to lead implementation of these reforms is laudatory. Last year, Governor Baker proposed requiring insurers, hospitals, and physician groups to increase by 30% the amount of overall health expenditures that support primary care and behavioral health. This includes treatment and services for mental health and addiction. His new state budget calls for $84 million in new investment to implement a roadmap for ambulatory behavioral health treatment redesign. These centerpieces of an ambitious reform agenda reflect Governor Baker's ongoing commitment to creating a health system that integrates physical and mental health to treat people holistically and effectively. MAMH is excited to continue advocating for these policy changes in the new legislative session. Beyond his policy, regulatory, and financing leadership, Governor Baker is a warm, generous, empathetic person who gives hours of his time to support our organization and others like us working to improve mental health and substance use services in Massachusetts. He, a recipient of MAMH's Friend and Leader Award, and First Lady Lauren Baker, who served for many years on the MAMH board, make time out of their very busy schedules to provide personal support to MAMH campaigns and events. I've had the privilege of knowing Governor Baker for 30 years, since he served as our state Secretary of Health and Human Services. He made a point then of getting to know the stakeholders and learning firsthand from people in care about their needs. His commitment to improving access to mental health care in the Commonwealth was laudatory then as it is now. Thank you for sustaining support and effective action to change conditions for the people of the Commonwealth, Governor. We salute you.
Thank you, Paul, Dana, and all the staff and supporters of Mental Health America and our own Massachusetts Association for Mental Health. And congratulations to my colleagues, Governor Tom Wolf and Governor Phil Murphy, on your awards today. I join Mental Health America in applauding their accomplishments on behalf of our most vulnerable individuals at risk for or living with mental health conditions. I'm honored to be a recipient of MHA's B4Stage4 Governor's Award this year. I've always appreciated MHA's work to tackle the stigma around mental health conditions. As Donna noted, Massachusetts has a long history of prioritizing mental health as an essential component of healthcare. This has never been more important than during the past year, with all the stress, anxiety, and isolation of the pandemic and the necessary but painful public health response. No one's unaffected by the challenges of this time. Most adults in the United States now report that their mental health has been negatively affected due to worry and stress over COVID-19. This is even higher for families struggling with job loss and economic pressures. We know that isolation and loneliness during the pandemic may present specific mental health risks for households with adolescents and for older adults. In Massachusetts, we've launched some new initiatives to try to address these needs, including our hashtag More to the Story Behavioral Health Awareness campaign and a new website called handhold.com to help parents address behavioral health concerns with their kids. We're also using this opportunity to make positive, lasting changes and reforms to our system. We joined with our legislative colleagues to pass legislation to permanently remove barriers to using telehealth, and that includes telebehavioral health. Telehealth, whether by phone or online, has made a huge difference in ensuring access to care during this pandemic, and we're glad it will have a framework to continue as we move forward. Our fiscal 22 budget proposal also includes $84 million in new funds to help reshape behavioral health in Massachusetts. Among other things, this effort will help create a front door to treatment, a new centralized service for people or their loved ones to call or text to get connected to mental health and addiction treatment. All in, our administration has increased state spending by over $400 million in behavioral health over the course of the past 4 years. And our comprehensive healthcare legislation filed a few years ago aims to prioritize behavioral and primary care by increasing spending by 30% in these areas within the context of an overall healthcare benchmark. We're going to continue to do all we can to prioritize behavioral health, reduce the stigma, and get people the help and the treatment that they need. This past year proved just how important that goal is, and it's one we take seriously. So again, I want to thank Mental Health America for this honor today, and I wish you every success in moving forward with your mission and your work. Thank you.